you want to get some chairs so you're both comfortable?
Yeah. I do normally get the lads to stand up when I do it.
Do they?
I sit down, get them to stand up because the blood comes out easy.
Okay, well, do what you normally do.
You stand there and I'll sit down.
So I just want to show people what's in the bag so they've seen it. You'll get to have a look more closely when you do yours. So you've got the card with the spots, okay, and the place to put the identification. You've got the alcohol pads that you saw. You've got a couple of little circular plasters. You've got the silica gel sachet, and you get 2 lancets just in case you don't get enough blood.
These ones because we don't have these. Just untwist and
press.
press.
Yeah, so you open it up, like so.
Oh, and push.
And then you press that against.
Oh yeah, that's fine.
Okay.
Give me a lot of confidence here.
Am I supposed to be wearing gloves for this?
Yeah.
Yes.
Oh, these dots are smaller than ours. Ours are massive.
So that might be why it's 3 rather than 5.
No, we've got 5,
Okay.
But they're bigger.
and we don't have date of birth on, which is where it just says date, and a lot of people just put the date, which is quite confusing.
Alright, let's have a look at you. We are warm, aren't you? I'm always tempted to blow. I won't. Waft. You dry? Yeah? Ready?
Brilliant job.
Well, you are good, aren't you? Wish they were all like you.
Of course they are. This is really easy.
Sometimes I let the lads do it themselves because I can't see nothing from here,
Yeah.
so I haven't got a clue where that blood's going.
Good God, Val, you're going to have to elevate in a minute.
Shall I tell you now I'm on warfarin? I'm not.
Somebody think you got a tissue or anything?
You said you had a rack that you put it in, and then
We
We've
just
got
have
a drawer.
a clear drawer.
So we leave it out open like that.
Obviously we'd have wrote the name.
We put the form for because we have a form to fill out as well.
So does it look like this?
It's got all them things on, yeah.
Okay.
So then we put it on top of the form. It's not normally blood like that. And we leave that to dry. We do reception about 6 o'clock, then we go down and pick it up about 11 o'clock at night.
Okay.
And then we fold them up, check the name, check the form, and put them in the bag with the
Silica gel. That's great. On the form, you've got if you've got a patient identifier number, you've got names, you've got date of birth, NHS number if you've got prison number possibly. You've got options in terms of what you ask for. So one of the first questions we got asked was, well, what if they say they don't want to be tested for HIV? So you can accommodate that. You just tick the things that you want. So in the Manchester system, you can have tests for Hep C, so that they test for the antibodies, and they would test and then do a PCR if they're positive. You can ask them to test for genotype from the dried blood spot, test for HIV, test for Hep B, and on this is also syphilis as well.
I was wondering about that one.
So you can choose what it's tested for. So if the patient has declined HIV, you just simply don't tick the box, and that's fine. They don't test it. So the discussion that we had was around whether they tested it and then they threw the results away, and was there a moral dilemma with not telling somebody if they were positive. I've had quite a few people say that things like what their history is, the reason for testing, things like that, suggest that it wasn't very important. We had PHE involved in one of our training sessions, and they explained that they use that information to help them track and plan how we manage the epidemic. So it's useful information to include as well. But the key thing is to make sure that the patient identifiers are there. Mr. Smith and nothing else doesn't work.